Good afternoon. My name is Jolene, and I'm a nurse here in the Cardiac and Pulmonary Rehab Unit of UnityPoint Findlay Hospital. So I'm here today to talk to you about cardiac and pulmonary rehab, what we do here, and give you a little bit of history about our unit. We just moved into this new beautiful unit about 2 years ago. We're part of the heart and vascular area, so we're right next to the cardiac clinic, and we're down the hallway from the cardiac cath unit. So we're just all in one area now, which is really nice. So we do offer cardiac rehab services here, and the cardiac rehab services are for patients that have had an intervention, like a stent or a bypass surgery. We also see patients in heart failure. We also see patients that have just had an MI. We also see pulmonary patients, and some of those patients that come to us have COPD or other kind of respiratory ailments like asthma, maybe pulmonary fibrosis, maybe they're getting ready for a lung transplant, or they've had the transplant. So we see a wide variety of both types of patients. Both types of patients do need a referral here from their physician, and when we get them here, we do a little bit of an evaluation on the patient and kind of write an individual exercise program for them both. So whatever their wants, their needs, their abilities, we write that exercise prescription. So the exercise is kind of the mainstay of both of our cardiac and pulmonary patients, but we also do a really nice education program. So part of our workhorse of our department are our treadmills. And so we do treadmill train our patients. And again, according to their wants and needs, if they have orthopedic problems, they may not be able to use a treadmill for very long or at all. And so we may have to pick another mode of exercise for them. So we want to keep people on their feet as much as possible because people have to walk, and that's what we want to achieve with them. We also have a piece of equipment called a new step. So patients that are unable to use a treadmill are able to use this piece of equipment, and it works their legs kind of like a sit-down stepping machine, and it also works their arms at the same time. So again, if they're unable to use a treadmill, we can get the same kind of cardiovascular benefit in a machine like this. And then way over to my right are our arm machines. And so they're strictly upper body cardiovascular machines. So if people can't use their legs at all, or we want to give them an upper body workout and raise their heart rate and raise their breathing, we use the arm machines. And so off to the far here, we do have free weights. So we do some resistance training with our patients because resistance training is a good part of a good, well-rounded exercise program. So the cardiovascular aerobic part of it, the resistance part of it, and we also have this little nifty machine here. It's kind of a resistance trainer where it'll work upper body like a chest press, a back row, and a leg press. So a big part of our rehab, again, is education. So it is our job to, when we meet a cardiac patient, see what risk factor they may want to change and to be their partner in helping them make that change. And our pulmonary patients, their main goal is to increase their endurance, to be able to breathe better, and to increase their quality of life. So they need a little bit different training than our cardiac patients. So we try to do a well-rounded program. It's all individual. We have individual treatment plans for every patient. And so what one patient can do, maybe another patient can't, but we have to give them what they need as an individual basis. So again, part of our services has education. We have a really nice education room where the patients can go in. They get some kind of formal education. We can discuss the topic of the day. So we may have a topic about dietary, heart-healthy eating. We may have a topic like understanding your lung disease. And so we let patients just kind of in a group talk about those things. We also have a dietitian that comes to see our patients, so they can set an individual appointment with a dietitian and figure out what they need individually in their diet. And we also have a respiratory therapist that works with us and our pulmonary patients, so they can get more instructions on their inhaler use, their nebulizer use, some of their pulmonary medications that they need to take. So I'd really like to thank you for joining me this afternoon. If you'd like to learn more about our cardiac rehab services, our pulmonary rehab services, or our whole heart and vascular areas services, please look at unitypoint.org. And thank you very much.